adjustable gastric banding steps we explained. 50 BMI patient, and he wants only band, and therefore I felt it may be okay, as he doesn't want any other surgery. Dissection starts at the left lateral aspect at the angle of his peritoneum is divided. Blunt dissection performed there, very minimal dissection, so that the band doesn't slip down. You're just forming a tunnel behind the esophagus. It is a Flcaccida approach. A lot of fat there. Lesser momentum is open and lesser sac is seen, and the crus, now the V of the crus is seen. There's just the blunt dissectors and open the space. Could use the same blunt dissector, but here I use the curved Johans. And brought it behind the esophagus to the left side. Holding the fat there so that it doesn't slip down. And then I'm holding the tonsil swab and pulled it behind so that it causes a bit of tamponadic effect, though not normally necessary. Lab band is introduced inside the abdomen using either the 15 or 18 port. The end of the band tubing is attached to the, or grasped by the forceps and pulled behind the esophagus. The tubing is pulled up until the band shows up, and the band is pulled behind the esophagus. And then locked into position. This is a lab band, therefore you pull it until the black of that flap locks into place. Then the band is pulled out through the abdominal and out into this abdominal wall. Then the band tube is connected to the port tubing. There's an interlocking mechanism in this lab band. The port is flush with saline and aspirated the air and leave about a couple of cc of saline inside the band. A tunnel is developed under the skin over the ribs, left lower ribs, and simply push it underneath so that it lies flat, facing the silicone area is facing upwards. It stays there and is easy access, especially in people who are very, very fatty. In others, one can put it over the left rectus sheath. Now that tubing is pulled into the abdomen so that there's no tubing is left outside, liver retractor is removed and the swabs are removed and the skin wounds are closed with a mini vac so that there's no blood under the skin.